Thank you for staying with us. The 19th of August marks World Humanitarian Day. The day is an opportunity to honour not just the victims of humanitarian crises across the African continent and the rest of the world. It's also a day that gives special focus to those who fearlessly venture into dangerous areas to bring much-needed aid to those who need it most. Well, joining us now to talk about some of the work that is being done in Africa from Freetown in Sierra Leone, Dr. Abu Bakar Tarawali from Action Aid International Sierra Leone Country Office. Joining us from right here in Johannesburg is James Kambaki, the Southern African Senior Human Resources Advisor for Doctors Without Borders. Doctors, thank you so much for speaking to us this evening. Now, the 2022 World Health WHD campaign shines a light on thousands of volunteers, professionals and crisis-affected people who deliver urgent healthcare and shelter and much more. Now, James, what are some of the challenges that these individuals face?
I think the humanitarian space is shrinking while the needs are increasing. This is the situation that we see currently around the world, where situation in western part of Africa, which is around the Sahel region, incidences which comes from conflict exacerbates situations that goes beyond the services that are provided in that particular places, and actually causes really a humanitarian crisis. Not only there, but in other parts of the world, in other parts of Africa, like South Sudan, now Mozambique, where we still see a lot of humanitarian needs in those countries as well. So I can say that humanitarian needs are increasing, yet the space to actually operate, as we saw also in countries like Ethiopia, is really shrinking.
Now, Dr. Tarawali, does the level of crisis reflect on the amount of work and potential work-related stress that affects these aid workers? Sorry, did you hear my? I think we've lost him. James, maybe if we come back to you and just focus on this question, and we really looking at the level of crisis. Does the level of crisis reflect the amount of work and potential work-related stress that humanitarian workers are exposed to? If we take, for instance, the level of crisis that we see in the Horn of Africa.
Yeah, the level of crisis is really intense, mainly because where humanitarian actors are operating is usually, one, very insecure contexts, two, is very harsh terrain, most likely the roads are impassable. Situations that we're intervening are really huge scale. That is for example, malnutrition. You see thousands of children who are malnourished, or patients who are overrun facilities. We can also talk about COVID-19 that also overstretched our services. So this puts a lot of pressure and stress to humanitarian workers operating in many parts of the world.
Dr. Tarawali, I hope you can hear me now.
Yes, I can hear you well. I can hear you clearly now.
Fantastic. Well, let's talk about the level of support that Africa is receiving in terms of humanitarian aid. Only days ago, WHO Director General Gabriel Deus talked about the amount of support that the Ukraine war has received versus what the Tigray region has received, for instance, and he drew, well, the comparison around that is that a huge amount of support has gone to the Ukraine war, a war that's only been around for 7 or 8 months, but the Tigray crisis has been going on for years. Dr. Tarawali, are you there? Can you hear me? James, we seem to be struggling certainly with Dr. Tarawali. I'm not sure if you caught wind of that question, which speaks to the amount of support that Africa is getting in terms of humanitarian aid versus the rest of the world and the crises that occur in other parts of the world.
As Doctors Without Borders, we take all the crises that happens around the world in matters of priority. Not only that, but also situations where the urgency is really high. We have been operating in Ethiopia for many years, not only during the Tigray conflict, but many years we have been operating in Ethiopia as well. We have not left out any of our projects as much as we have increased our activities in Ukraine, because we are an emergency organization. We are without borders. We work independently. We actually try as much as possible to see where we can save more lives as much as possible. So we do not really discriminate where our operations is going to be. Our activities in Africa remains quite higher as compared to many parts of the world as Doctors Without Borders. So I think the intensity of our work really depends on the urgency, but we have not at all neglected our operations in Africa. We are in many parts of Africa. Actually, the biggest budget of our operations is in Africa.
Well, when we celebrate World Humanitarian Day, we obviously look at the safety of volunteers. We look at the safety of many of the personnel, Doctors Without Borders, that are going out really into places of war and violence and conflict, if you will. Now, 148 workers were killed in 2021. How safe are your doctors, and what has the impact of war been on their safety in the last few years?
We try as much as possible to mitigate risk. We do a lot of assessments and explores before we intervene in a particular context, in a particular place. And in most cases, what we rely on is the goodwill and the participation of communities where we work in. Of course, different governments and the factions that we support are actually part of our stakeholders, but our reliance in our safety and security is usually the community that we work with. The risks are there. We try as much as possible to mitigate them. We try as much as possible to put policies and guidelines and processes and procedures that ensures that we save more lives than lose lives. So we generally do not send our staff to actually get killed. We do not do that. So we try as much as possible to keep them safe. We evacuate. We have processes of evacuation. We have security measures where we can actually operate, how we hibernate, when we actually provide services. But we want to, as much as possible, within the limits of those risks, to continue to save lives and alleviate people's suffering as much as possible.
Now, James, let's come back to the Tigray region. And we do know that a few months ago we reported that aid, and certainly to some degree, medical support and services were unable to reach the intended audiences because of the conflict in that region and certainly resistance from some of the groups that were warring. Do you directly deal or negotiate your way for Doctors Without Borders to get into these areas, or is that something that happens between governments or between feuding parties to create passage for Doctors Without Borders?
As Doctors Without Borders, because we are an independent organization, we try as much as possible to negotiate for our access also of patients to reach our services. we do not rely on third parties to negotiate access for us. We try to do it as much as possible. And as we say, biggest stakeholders that we rely on are our beneficiaries, the patients that we serve, the communities that we serve, to actually provide that security for us. We do not want to align with different fighting factions. Of course, we try as much as possible to also analyze and assess the type of risks that we are getting ourselves into. But we really try to negotiate ourselves. And that has been our stand in many parts of the world where we intervene. We are always on ground. We are in proximity with the populations that we're suffering. We bear witness, and we advocate for the suffering of the population. So we have to be there. We have to negotiate ourselves.
Now, James, one of the issues that I certainly would like us to look at in this month where we are celebrating women is the issues around women that are raped and abused, particularly in areas of conflict. What is the prevalence, certainly in areas of conflict, such as the Tigray region, that your doctors would come into contact with?
Sexual violence is one of our priority areas whenever we engage into, whenever we run our health programs, and we want as much as possible to give access to women to get services from our facilities. So we put it as our priority whenever we actually intervene in any conflict area or in any intervention. We have to have a sexual-based violence program that supports. We cannot actually quantify the numbers as yet, but we know this is part and parcel of the work that we must do in those particular areas and in those particular contexts where we operate. So sexual violence is really usually a priority, as much as we implement also mental health programs. We try as much as possible to ensure that the most vulnerable, who are in most cases women and children, actually get the necessary service that is essential for their livelihoods.
James, appreciate your time this evening and certainly wish you a memorable World Humanitarian Day tomorrow.
Thank you very much, and thanks for inviting us to talk.
James Kambaki, the Southern African Human Resources Advisor for Doctors Without Borders, speaking to us ahead of World Humanitarian Day tomorrow. Well,